So namaste dear friends, here we are once again with a new topic about the anatomy and physiology. So today we are going to talk about the respiratory system. So when the term respiration comes to your mind, as we all know, in general it relates to your breath. In the last 2 days we have discussed about the introduction to the anatomy and physiology, the concept of cells and tissues, the types of tissues, and anatomical movements and terms. Now we are moving to the next topic, that is the respiratory system, which we call the breath connection. So respiration in relation to the breath. As we have already discussed at the first chapter, in the first class, that our main focus of this training is on your posture and breath. So before to go into the pranayama section, how to breathe properly, we must have to know about some idea about the system, that what are the different organs that forms the respiratory system, and how these components connects together and perform us and help us to breathe properly in a right manner. So it's not only about the breath, it's about the whole connection of the breath in relation to yogic practices. Why it is important to study about this subject? Because as we take in one example of pranayama, right, that you call the breathing exercises. In the yoga we say pranayama. The different types of breathing exercises we have. So in this pranayama, as you're taking a class of the pranayama, so it's not only just inhale, exhale, inhale, exhale. Before to start that pranayama, we must have to know about the pre-existing condition of the student in relation to the breath and cardiac imbalances. So it's not only you just sit and start, no. Sometimes you came with the good breath, and with the forceful breathing, the breath moves out in a order, and then you feel breathlessness sometime. According to the age, the breath changes. If you take an example of a newborn baby, if you have seen a newborn baby, how the breath is? Full breath, and it is more faster, because the lungs are not susceptible to correlate with the external temperature, external atmosphere. So as the child grows easily, the breath gets stable. Same thing if we go to the old age. What happened that time? You have seen the breath is also more shallow and faster breath. So these, according to the age, according to the temperature, according to the surrounding, according to the atmosphere, the rate of breathing changes. The pattern of breath changes too. So guys, that's why whenever you are stressed, tired, the breath becomes automatically shifted to the chest breathing, and the breathing pattern is, and that affects our whole systems. So pranayama doesn't mean just start, sit and do inhale, exhale, do the kapalabhati. If it doesn't know about the functioning of the heart and lungs, if it doesn't know the components of the respiratory system, is it possible to explain the benefits to your students? Will it be possible that you can explain do's and don'ts? So that's why we introduce this anatomy and physiology subject here, that where does your different organs of the respiratory system has been situated, and how does it function? That so many different components of the respiratory system, maybe one of them is not functioning properly. Does it affect the whole breath pattern or not? Yes. So that's why the respiratory system, which we are going to talk about in today's class, it is a very beautiful system, guys. If you control or if you manage this system of your body, the life becomes more easy. The other functioning of the organs get more easy too. Because as we all know, we all need oxygen. Without oxygen, without breath, life is possible? Not possible. It doesn't mean only that to breathe. What it matters here, am I breathing properly? Or my breath rate, my pattern of breathing getting more out of balance? Sometimes you have seen when there is a condition when you are angry and you try to speak too much faster and you're fighting with someone. What happened at the one point? What happened? You're trying to speak faster. One time you feel hyperventilated. So breathing is out of pattern. So that's why we always say we have to speak slowly, we have to take time so that inhalation and exhalation happens properly and there is more oxygen consumption goes to your lungs. So that's why, guys, take your time. There is no need to be in a hurry. Check your breathing pattern. Am I breathing properly or not? Am I breathing from my belly or am I breathing from my chest muscles? So this is the pattern which we needed to be followed. That awareness and regular checkup, self-check, right? Self-check by yourself. How am I breathing? From where am I breathing right now? So take a little pause in your life and check your breath pattern. So now we are going to talk about the respiratory system in more depth. So respiratory system that we call the breath connection. The respiratory system, the breath connection. So how many times in your life you are connected with your breath? With awareness. I am also breathing, you are also breathing. But we must have to check the different breathing pattern in different individuals. So from today, just go and stand silently and just observe the breathing pattern of a different human beings, the different individuals which is around you. And just observe, then we learn that what type of breathing we have to suggest a particular type of student or the particular type of individual. You can compare in the child, in the adult and in the old age people. Then you can learn more, guys. So you have to check the different breathing pattern and don't tell them don't tell them that you are checking this. Just only sit or stand silently and observe. If you tell them properly, then they become more conscious and they shift their breath easily. So we have to cross-check. Check and then cross-check again. So basically when the term respiration comes to your mind, so the first thing comes is the breath, and the breath, there is an inhalation of, yes, oxygen, and the exhalation of CO2 and other lethal gases to be out from the body. So there is an inhalation of oxygen and exhalation of carbon dioxide. So inhalation of oxygen and exhalation of carbon dioxide and other lethal gases to be out from the body, which we don't need it in much amount. So the next we come to the organs now. What are the different organs that forms your respiratory system? So it starts from the nasal cavity that we call the nose. Right? The nasal cavity, nose. If you remember, sometimes people ask you that, breathe through your nose, breathe through your nose. Why people ask you to breathe through your nose? Is there any important reason for that? That only to breathe through your nose? So breathing through your nose, there are some benefits of breathing through your nose. When you're running, guys, right? So you're not breathing through your mouth. You're breathing through your nose. Mostly people suggest in athletics, sprint runners, if you see, 200 meter, 100 meter, they always breathe through the nose. Because we need the good quality of air and it has to be purified or filtered. So it can be reached up to the muscle tissues by the lungs. Right? So, nose. Now the next question arises that what are the structures inside your nose that helps to filter or purifies my air? So inside the nose, that we call the primary external opening, primary, not secondary one, right? So that's why people ask to breathe through your nose. That's why we call anatomically, physiologically, this is our primary external opening. So nasal cavity is primary external opening. So this primary external opening, when we talk about, so the components which is inside the nose that helps us to purify or filters the air. Inside the nose, as we all know, we have hair follicles. We have mucus. Sometimes that mucus, it comes out. So the nose feels more dry. And that time you always suffer to take a normal breath. So nasal cavity has hair follicles and mucus that helps to filters or purifies the air. So nose has hair follicles, mucus, which helps, purifies or filters the air. So that's why people ask when the breath has in a different level, if you're breathing through your nose and you feel difficulty in the breathing, if you're breathing through the nose, it easily gets filters, purify, and the fresh oxygen, a good quality of oxygen delivers to our lungs. So then the cell can get good fresh oxygen. The blood can get good fresh oxygen. Now, this is about the nose, my dear friends, right? The primary external opening, it has hair follicles, mucus that helps, purifies or filters the air. But sometimes you feel that your nose gets closed. When sometimes you suffer from any cold or cough, what do you say? My nose is blocked. It's easy to breathe. So if you close your nose, you speak, you feel heaviness. And lack amount of oxygen delivers to the, lack amount of fresh oxygen that delivers to the lungs and other cells and tissues. So when the nose is closed, right, when the nose is closed, so from where we breathe then? So then we breathe through the mouth, right? So mouth or oral cavity we considered as a secondary external opening. So the mouth or oral cavity. So the mouth or oral cavity that we considered as a secondary external opening. So mouth or oral cavity. This is your secondary external opening. So now if we ask like the mouth, what is the advantage to breathe through the mouth? Because the mouth has germs also. So no more fresh oxygen delivers to the cells and tissues and to the lungs. And if I ask you guys, in the mouth, do we have hair follicles? We have hairs inside the mouth? If you open your mouth, if you see in the front of mirror, there is no hairs. Right? So, in the mouth, sometime when you run for 100 hours, 200 hours, or 100 meters or 200 meters, right? Sometime as we run for sprint running for 100 meters or 200 meters, I just stop. How's the breathing pattern is? Sometime you climb the stairs to the 4th floor. Breath is. So the mouth lacks hair follicles. There is no hair follicles inside the mouth. So only advantage to breathe through the mouth is when we need more amount of air in the shorter duration of time. It doesn't matter what is the quality of the air. That time we have to fulfill the amount of air inside the lungs, right? The amount of air inside the lungs, so it cannot deflate. So guys, that's why you take an example like if we talk about like if you have seen the pregnant woman, always as the belly grows, it releases the pressure, it creates the pressure on the diaphragm. So the breath automatically shifted to the chest breathing. So most of the pregnant women are mouth breathers. If you have seen the patient who suffer from the asthma, there is a hyperventilation. You can inhale easily, but the exhalation is a more difficult thing. So these kind of imbalances, so that's why you have seen the asthmatic patients, always their pattern of breath is, there is snore sound is there. And the breath is more shallow, right? Shallow breath is there. So if we talk about the mouth, it lacks hair follicles. So the only advantage when we need more amount of air in shorter duration of time. So this is the function of the mouth in relation to the breathing. So when we need more amount of air in the shorter duration of time. So nose filters or purifies the air. Mouth, it lacks hair follicles, so it can compensate when the nose is closed and we breathe from the mouth. So it fulfills the quantity of air inside or the volume of air inside the lungs. Now we come to the next organ after the nose or mouth. There is an organ, or we say it is a passage, that we call the pharynx. So this pharynx is an passageway, it is an area, right? If you look at your manuals, the pharynx is an area that covers your nose, that covers your mouth. So the area is like that. That covers the nose, that covers the mouth, and that covers your throat too. Right? That covers the throat. So pharynx is an area, and this organ and this passage we consider in both. In the respiratory system also, or in the digestive system also. So this is the passageway. But there is a one flap of elastic tissue which has an important role under this area of pharynx. That is we call epiglottis. It is a flap of elastic tissue like this way. So if we look at here, so suppose if you look at from the front, this is the front view, right? This is the front view. If you look at from the front, inside the throat here, there is a one line and there is another line, right? So this line which you see, the first one, this is the air pipe. The line which you can see, this is the black one. This is your food pipe. And a flap. This is the flap of elastic tissue. That is we call the epiglottis. So the main role of here is considered by the epiglottis. So that's why we consider this epiglottis is in both systems, in the respiratory and in the digestive system too. So suppose, if you look at from the front part of body from here, this is the red one is the air pipe, the black one is the food pipe here, right? Or the black one is the air pipe and the red one is the food pipe. So my finger has been considered as the role of epiglottis. Black, air pipe, red, food pipe. So as you swallow the food, right? As you swallow the food, this is the flap of elastic tissue. As you swallow the food, what it does, it closes the air pipe. And the food goes into the food pipe. It is a flap of elastic tissue that we call epiglottis. As you swallow the food, this flap closes the air pipe, the black one, and the food goes to the food pipe in the red one. So this is air pipe in the front and the food pipe on the back, just next to this spine. So basically that's why people ask you guys, what people ask that, what is the role of this organ of the epiglottis? It passes the air also from nose to the mouth to the throat. But epiglottis has an important function. It prevents the entry of food to enter into the air pipe. That's why people ask that while you are eating, please maintain the silence. It's not there is a one certain reason over there. Sometimes you eat faster and you are speaking too. What happened? You feel choking. You feel choking because some food particles enters into your air pipe and it restricts the passageway of air that time. And that time you have a problem with the breathing too. You feel like you're stuck somewhere else. So that's why take your time. While you're eating, it takes only 10 minutes, 10 to 12 minutes. Eat into the silence so that you can enjoy the taste of food. You can meditate with the food too. And you can prevent that choking, that the food particle doesn't enter inside your air pipe. So the epiglottis is a time to close the air pipe completely. So that's why guys, eat into the silence, maintain the silence while you are eating. So main function of this epiglottis, it prevents entry of food to enter into the air pipe. So this is the main function of your pharynx, is the passageway and the epiglottis. So these three organs we have discussed right now. The first one, nose, mouth, pharynx. The next one is your larynx. That is we call the voice box or the vocal cord. The larynx, voice box. So cartilage is also there in the larynx here. So it is we call the Adam's apple too. If you can see, this is more prominent here, the Adam's apple here, right? It is more prominent in the males. It is little bit protruded outside. So voice box. Yes, so the voice, it is responsible for the voice also. But guys, this is also the passageway for air. Right? This is also the passageway for air too. How we can see that the passageway for air, so larynx, suppose this is the structure of the larynx, right? The structure of the larynx here. So inside this larynx, so many different things we can see. So larynx is like this way, the round structure, there are muscle around the larynx. Right? The muscles, these are the muscles, suppose. These are the muscle around the larynx. So if you're trying to speak too much faster, right? If we are trying to speak too much faster, what happens to the muscles around this area? It gets over-contracted. Right? It gets over-contracted. So it reduces. What it reduces? If you're trying to speak faster, muscle has to over-contract. It reduces the passageway for air. Right? It reduces the passageway for air, so the less amount of air reaches to your lungs. So that's why people say we have to take time. When you have to speak slowly, take your time, so that there is no restriction of the air to enter into the lungs while it is passing through the larynx. If you're trying to speak faster, you feel that sometimes you feel choked. You feel hyperventilated because less space we have that the air reaches to the lungs. If you place your three fingers here, you can see the vibration, the cord vibrates. If you are doing you feel vibration. And as you stop, you feel relaxation. So most of the professional singers, if you have seen, they train these muscles around the laryngeal muscles, so they can hold the note for the longer duration of time. In the Ujjayi breath also, in Ashtanga, in Vinyasa flow, when you're taking that Ujjayi breath, it reduces that more amount of air. So there's contraction of these muscles here. So we use the chest muscles more because there is more jumping, more movement is there, so the core is always engaged. And the diaphragm comes under the core too. So we never ask for them to use these muscles because they are already engaged in the movement, in the dynamic movement. So we need the stability from the core. So that's why the Ujjayi breath we use in Ashtanga and Vinyasa. So main function, it is the passageway for air also and responsible for the production of sound. So this is a passageway and responsible for the production of sound. Now, we talk about up to the larynx. So trachea, if you have seen the spring, right? The spring has a recoiling. The same thing, we have a trachea, if you see, just down to here you feel the rings here, these rings. These are the trachea. This is the one line, the tracheal lining, right? So trachea has an elastic recoiling of the cartilage. It's like in a spring. So now the question arises, what is the function of the trachea? Yes, this is also the passageway for air, right? This is also the passageway for the air. After the larynx, the air passes through the trachea to the lungs. But there's one more main function of the trachea. That inside the trachea, we have a mucus too. Right? Inside the trachea, there is this red color is a mucus. So inside the trachea, we have a mucus. So function of this mucus, yes, it is for the lubrication also. Another function of the mucus, that sometime when we are exposed to some polluted environment, some polluted air outside, our body's internal temperature is different, the external temperature is different of the air. So when we're talking about this, like this internal, external temperature or the environment difference. So what happens, guys, the dust, there is a dust outside in the air. So that dust, basically, that dust sticks to the mucus, right? That dust sticks to the mucus. So main function of the mucus inside the trachea and the main function of the trachea in relation to dust or in relation to mucus is that it prevents the entry of dust to enter into the lungs. So that dust sticks to the mucus and sometime it absorbs in the membranes, and sometime when you feel choking here, right, you feel choking. So there is a reflex that comes when you're trying to do, you place your 3 fingers over here, and sometimes what you try to do, and then sometime you're trying to spit it out. So different colors of mucus represent different conditions of the body. Like we have brown, black, yellow mucus. We need that mucus. We could not say we don't need it. We need a healthy mucus here. So main function of the trachea, that the dust sticks to the mucus inside the tracheal lining, so it prevents the entry of the dust to enter into the lungs. So prevents entry of dust to enter into the lungs. And this trachea is basically the elastic recoiling of the cartilage. This is the function, prevents entry of dust to enter into the lungs, and trachea is the elastic recoiling of the cartilage. So the trachea is designed like this way that it can remain open for the air at all the times, right? The trachea has designed in that way that it can remain open for the airways at all the times, whether you are in standing position, whether you are in a lying down position, whether your head is upside down. Suppose the trachea has this shape, right? Suppose the trachea has been designed with that shape. So as you kinking your head up and down, it obstructs your airflow in these type of movements. So that's why the trachea is designed in that way that it can remain open for the airways at all the time. So there is no obstruction for the oxygen supply to the lungs. So I hope this is clear to you, my friends, that this trachea, elastic recoiling of the cartilage, prevents entry of dust to enter into the lungs, and elastic recoiling is there. So this is the area that is trachea, these rings. Then from here, after the trachea, the next organ or the next part which we say, after that, this trachea is divided into two parts. This trachea is divided into two parts that we've called the branches here, right? So that is your right bronchi, and this one is your left bronchi. So right and left bronchi. So now the right bronchi brings the air and the left bronchi brings the air where? After that, the next organ that comes is your lungs. So right one brings the air to the right lung, and the left one brings the air to the left lung. So this is the passageway for air to the lungs. So right lung and the left lung. After that, these bronchi divide into, if you have seen the roots of the trees, right? The roots of the trees, so many roots, the branches, so many roots, you cannot count easily. So same thing, these bronchi now divide into so many branches, primary, secondary, tertiary. So divide into so many branches. So there is a dividation into the so many branches like the root of the trees on the both lungs. And finally, on the down part of the lungs, at the bottom of the lungs, it changes into the grape-like structure that we called alveoli. Right? So there is a branches on the both side, bronchi, bronchioles. So it divided into the so many branches and finally changes into the small grape-like structure, alveoli. So the function of this alveoli, from here the air passes, travels to these different branches and reaches to the alveoli. Why we ask you to breathe through your belly? If you are breathing through the chest muscles, the upper chest, if you are breathing through the upper chest or the upper part of the lungs, so the air will take more time to reaches to the alveoli. Right? Air will take more time to reaches to the alveoli, and alveoli has a function. Alveoli has a function that is responsible for the exchange of the gases between oxygen and carbon dioxide. So this alveoli responsible for exchange of gases between O2 and CO2, that is oxygen and carbon dioxide. So if you are only breathing through the chest muscles, upper chest, the upper part of the lungs, less air with the less speed travels to the alveoli, and in the bloodstream less amount of oxygen travels, and there will be more degenerations of your cells and tissues. So that's why we always ask you breathe through your belly, or the belly breathing, diaphragmatic breathing. Use these muscles, but in less ratio. So this is how we say the right bronchi, left bronchi brings the air to the lungs. Then there is a primary, secondary, tertiary division in your bronchioles. Then finally it changes into the alveoli, and alveoli has a function for the exchange of gases between oxygen and carbon dioxide. So now I hope this is clear to you. Next we go to the main muscle, or this is we consider as an organ too. So now you have a question in your mind also that right side of the lung has a different shape and the left has a different shape. Why is it so? The right side has a different shape, left side is a different shape. So let it clear this first, that why it is different in shape, both lungs. So here we go. So this is the trachea again, I am drawing here. So now you see guys that the right and left lung, right? So this one is the right here. Left lung. So if you're talking about this shape, we can see here also right lung has three components: upper part, middle part, lower part. But the left has only two, upper and lower. Right? So this is upper part, middle and lower. But the left one has only upper and lower. And this is the space that we called cardiac notch. What do you call it? Cardiac notch. And this is the space for heart, because the heart is going like this way. It's not completely on the left. Start from the right and most of the part considered on the left side. So this is we call the cardiac notch, space for heart. So that's why we have a different type of lungs here. The right one is different and the left one has a different in shape also and size also and in weight also. Right one is more heavier than left one. In the right lung there is more air storage, left lung has less storage in comparison to the right lung. So next is your muscle that we call the diaphragm. It is an organ also, very big muscle it is. So diaphragm is a dome-shaped muscle which is beneath the lungs here, right? So diaphragm.
If people they want to do iftar and they cannot come at 7:30. We need to change that.
So function of this diaphragm, some people consider it as a muscle, some people consider it as a muscular organ also. And this is the major muscle of respiration. If we say about the chest muscle, the intercostal muscle, these are the accessory muscles that supports. But the main muscle is your diaphragm, the main important muscle. That's why people say, when people ask you to breathe through your belly. So belly breathing means, is there any air that goes to the stomach? No, there is no air that goes to the stomach. Belly breathing means to activate your diaphragm, to activate these muscles, because nowadays of the sitting job, this is happening, right? So pressure on the diaphragm and people forgot how to use these muscles properly. That's why the breathing pattern, we are changing into the reverse breathing pattern. So people don't know, maximum people don't know how to use this diaphragm actively. So pressure here, lack of blood circulation here, and when the diaphragm doesn't contract or relax properly, there is not a full expansion of the chest. There is no expansion of the lungs too. So problem is here guys that, what does it do, the diaphragm, the main function of the diaphragm? As you see, if there is any muscle that contracts, What happens to the muscle? If suppose I am contracting my biceps from here, what is happening to the length of the muscle is remain shortened. But diaphragm is opposite. It's like a dome-shaped muscle when it contracts, right? When it contracts, suppose this is the whole muscle. When it contracts, it flattens down. It doesn't become shortened, it becomes more lengthened. It creates space for the lungs to expand. So when the diaphragm contracts, it flattens down and enlarges the chest cavity for inhalation. When it relaxes, it becomes shortened. So the problem is here. So this muscle or this organ functions a little bit differently here. If suppose you place your hands here on your ribs, on the side of your ribs, when you inhale, so you feel that there is an expansion of the chest. When you're moving with the belly, if suppose you're not moving with the belly, don't move your belly and just try to only lift your upper chest when you inhale. So there is not a full expansion of the chest. So these are the simple examples which you can use and you can get an instant quickly result. You can feel the proprioception on your body that is it contracting. If I'm using this, the diaphragm, more expansion is coming. But if I'm not using the diaphragm, it stuck here. If I'm using and lifting my only the upper chest muscle, I feel stucking here. So guys, during inhalation, during exhalation, there are the two passageways, right? So if I talk about the inhalation, so during inhalation what happens? The muscle has an opposite action. Or this organ So during inhalation, the diaphragm, the muscle diaphragm contracts. So when it contracts, it lengthens. So diaphragm contracts and expands the chest during inhalation and expands the chest cavity. So it expands the chest cavity for inhalation, so the maximum amount of air can reach to your lungs. During exhalation, so what happens during exhalation is, if you just check your movement, so during inhalation, we check that chest enhance, enlarges, expand. During exhalation, so the chest contracts and diaphragm relaxes. So there is an opposite movement here. During exhalation, chest contracts and diaphragm relaxes. So this is the movement of the diaphragm, and this is the main muscle of the respiration and the part of the core muscles too. So after the diaphragm, if we go to the next part, that comes to the mechanism of breathing. Okay guys, so when we're talking about this mechanism of breathing, so there is, you cannot say like there is always inhalation, exhalation, inhalation, exhalation. Three phases, the three main phases that we called, two you all know, inhalation and exhalation. But after inhalation, there is a microsecond pause, right? The microsecond, I'm not saying for 2 minutes and 3 minutes. There is a microsecond pause is there, and then the next cycle starts. So three phases in the mechanism of breathing. The first one we say inhalation, exhalation, then there is a little pause. This is we call the one cycle of breathing. So I could not say that inhale, exhale, one cycle, and then the next cycle start randomly. So inhalation, exhalation, and there is a pause, and that considered as a one cycle. If there is continuously inhalation, exhalation, the muscle which are responsible for inhalation and the muscles which are responsible for exhalation, they become more stressful. So that's why a gentle relaxation for very microseconds, for 0.02 second or sometimes 0.04 second is there, and then the next cycle begins, that we call the one cycle of breathing. So now the next question arises with you, that what is the average respiratory rate? The average respiratory rate of a breathing in a normal adult from 16 to 40 years of age, or you can consider from the 18 to 40 years of age, without any previously existing history of any cardiac imbalance or any respiratory imbalances. Means any illness in relation to the heart or any illness in relation to the respiratory system. So this is the one cycle. If I talk about the average respiratory rate, per minute, how much it is, right? The average respiratory rate per minute. It's different also, guys. If you check the newborn, it's different. If you check after 55, it's different. As we have discussed earlier, that the breathing become more shallow, more faster. But in a normal individual, it depends upon the activity, the previous activity. If you just climb the stair for 4th floor and you stop and that time you measure your respiratory rate, it becomes high. Because the heart is pumping, lungs has to take more oxygen inside to deliver to the muscles, so it becomes more higher. But in a normal state, it becomes 12 to 15 breaths per minute. It can be decreased also if you are doing some specific type of practices like pranayama, other breathing exercises, meditation. Your breath and your heartbeat becomes more stable and more slower. It becomes higher also when you are in the stress, in the anger, in the anxiety, or if you are going for the sprinting and some dynamic sports and some dynamic stretchings, the heart rate becomes more increased. So this is average. We are considered that 12 to 15 breaths, 12 to 15 breaths per minute. So this is the mechanism that comes under the 3 phases, that is inhalation, exhalation, pause, one cycle, average is 12 to 15 breaths per minute. So for today's activity, you have just try to check yourself, your friends, your neighbors, ask them, just sit silently and just measure the different breathing pattern and check this average respiratory rate and check with the previous existing diseases or imbalances. So then you can correlate easily, then we can apply some breathing exercises with that also. So this is all about, guys, for the respiratory system as the breath connection and with the mechanism. Now the next question that arises in your mind, that why I am doing these yoga practices, what is the relationship in relation to yoga practices with your respiratory system? So there are so many practices that has a beautiful effect, an amazing effect on your different organs or the whole respiratory system. So effects, what are the effects of yogic practices? On a respiratory system? So there are different. Now, if we correlate the yoga and to the gym and other kind of exercises. How much awareness you have in relation to your movement with the breath. In the gym you are trying to do and do the dumbbells, lifting heavy weights. Always have you ever focused when you try to lift 20 kg, what happens to your breath? This happens. This is the reaction of your face. The breath got stuck. So there is no awareness on the breath, my dear friends. When you are going to the movement in the yoga asana, there is always the teacher has an instruction to yourself. Inhale, go up. Exhale, bend forward. So there is awareness with the breath also. So you are not disconnecting from your breath. So when you are going against the gravity, inhalation is there. When you are going with the gravity, exhalation is there. So just to expansion of the chest more, because when you are doing any kind of activities, whether asanas, whether you are doing running, whether you are lifting your heavy weights, what the muscle need? Muscle need a good blood stream. Muscle need a good blood circulation. And the food for the muscle is oxygen. And when there is no sufficient amount of oxygen delivered to your muscles, muscles become sore. There is a DOMS formation, the delayed onset muscle soreness. More lactic acid forms inside your muscles. So that's why prior to yoga, prior to asana, after asanas, what we included, a gentle pranayama practices, so that you can bring awareness on your breath easily. It's not just to start the asanas or the flow and the different types of yoga. So this increases the more blood circulation everywhere to your muscles, and when the blood circulation is good, more oxygen rich blood supply you can get, and the muscles will delay soreness easily inside your body. So that's why the pranayama also, it proves that the pranayama reduces the muscle stiffness. That reduces the muscle stiffness. So there is no more lactic acid formation. So your muscles can work for the longer duration of time, because without any stiffness, without any imbalances, and no muscle strain. Then we come to the another way, like different pranayamas we have when you suffer from cold, cough or sinusitis, like the inflammation of your sinuses. So if you are doing some dynamic pranayamas, like if you are doing the Kapalbhati, so there is a forceful action. So it can help to release the blockages from here. It can help to open the sinuses from here. So these different types of pranayamas that with the beginners you can train with the Anulom Vilom, the alternate nostril breathing without retention. When you have to work with more strength training, like if you have to go for the more strength type of exercises like Vinyasa, the movement Ashtanga, where you have to hold, we have to flow also, then we can slowly add retention to that. Then we have a Ujjayi breathing pattern also that is helpful for your Ashtanga practices, the Vinyasa practices. So these kind of different pranayamas will help to regenerate your cells and tissues. We have a Brahmari, the humming bee pranayama, to releases your mind, to calm down all the things which is going inside, and to bring awareness to your own self. When there is a temperature is more hot, if there is any inflammation inside your body, you can use the cooling pranayamas, the Shitli, Shitkari. So these kind of practices you can use. So these are the benefits that if I am doing yoga, so each and every practices has its own impact. The different type of meditations, the silent meditation, right, the guided meditation, the yoga nidra also calms down and stabilizes your breath. So it releases the extra pressure from your lungs, from your heart, and your system works properly and gives you the healthy and healing effect from your practices. So do believe that all the practices has an excellent, good impact on your body and on yourself. So thank you so much. I hope this is clear to you with the respiration. So always connect with your breath, be connected with your breath, and don't forget from where I am breathing. Namaste. Have a nice day.